Good morning, everyone. Welcome to the Institute of Medicine, Chicago. My name is Courtney Avery. I'm a Billings Fellow and Program Committee member and a member of the Board of Directors. It is my pleasure to welcome you to today's session, and I thank you for attending this webinar. Today, we will address how a not-for-profit, Chicago Family Health, and DL3 Realty are about to revitalize the South Shore and affordable healthcare, housing, and retail. For the past several years, and nearly every day in the news, we are seeking ways to decrease health inequities and achieve more health equity. Today's presentation will specify the project and provide signs of change and anticipated progress. The Revitalization South Shore project with the Chicago Family Health Center is part of Thrive Exchange and was a finalist for the Pritzker Traubert Foundation $10 million Chicago Prize. This is the Chicago family's first initiative into mixed house use of housing and retail in the Chicago area. Chicago Family Health has 6 other locations. Today's program is part of IOMC's programmatic series on public health, population health, and community health, focusing on reducing health disparities and achieving health equity. Today's agenda includes a presentation, which will be followed by a question and answer session. You will be able to post questions in the question box, and please use the chat for sharing your comments. We'll monitor those. Today, I'm very excited that we have 2 accomplished leaders with us. Today's speakers are Sherry Pace, MBA, CEO of Chicago Family Health Center. Ms. Pace was named Chief Executive Officer at Chicago Family Health Center in July 2022. Ms. Pace manages an annual operating budget of $30 million. And oversees more than 250 clinical, administrative, and support staff across 6 healthcare sites. Before accepting the CEO position, Ms. Pace was the Chief Operating Officer at Chicago Family Health Center. And prior to joining the organization, she served in numerous senior leadership roles during her more than 30-year career in healthcare, including Chief Operating Officer at Hamilton Community Health Network and FQHC in Flint, Michigan, and as administrator for the divisions of internal medicine and endocrinology at the University Hospitals of Cleveland. Ms. Pace received her undergraduate degree in health administration from Ohio University and her MBA from Eastern Michigan University. Our other accomplished panelist is Tanya Kadadaki, Director of Partnerships and Residential Investments for DL3 Realty. She is a seasoned manager and director in affordable housing and community development from conceptual to exit. Her experience includes lending and equity investment expertise, structural experience with 9% and 4% LIHTCS, which is the lending and equity investment experts, rent vouchers, and historical tax credits. She manages teams and staff to closing from construction, completion, and operations. Her significant accomplishments include Invest Southwest RFP for 79th and Exchange Streets, plus a 9% LIHTC award for DL3 Realty, development and team management of $140 million in mixed use and mixed finance development project, Wilson Yard. She was appointed by the City of Chicago to guide efforts and serve on Finance Committee with the Chicago Housing Trust. Their objective is to develop affordable houses for sale, and she also received a BA in history from the University of Illinois, Champaign-Urbana. She earned a master's degree in urban planning and is pending from the University of Illinois. If you are visiting with us for a first time, here's a brief overview of the Institute of Medicine. The Institute of Medicine is an independent, nonprofit organization of distinguished leaders in the health field who collaborate to improve the health of the public, drawing upon the expertise of a diverse membership and other regional leaders. The IMOC addresses critical health issues through a range of interdisciplinary approaches, including education, research, communication of trusted information, and community engagement. The Institute of Medicine is a 501c3 nonprofit organization. Before our presentation, this is a quick reminder that on February 4th, 2023, IMOC will host a virtual session titled Maternal and Child Health. The webinar will introduce IMOC's efforts in maternal health and its upcoming initiative for the next 2 years. Drs. Anita Stewart and Lisa Green will discuss the efforts. I would like to move this presentation to Ms. Sherry Pace and Ms. Kadaki to share the exciting details and objectives of the Thrive Exchange and Healthcare Project. Welcome, everyone, and please proceed.
Good morning, everyone. As Courtney mentioned, I'm Sherry Pace, and I'm here with Tanya Kadaki, and we're excited to be here to talk about our project with Thrive Exchange, a transformative project for the 79th Street and Exchange intersection here on the south side of Chicago. Next slide, please. Thrive Exchange Partners is planning for a transformational change in the South Shore area. Thrive Exchange plans to serve 15,000 patients with our project, attract 100 working families into the community, and create 450 jobs and entrepreneurship opportunities. And this is an overview of our project.
So let me talk a little bit about how the project was initially developed. Let me also first say, I'm Tanya Kadakia with DL3 Realty Advisors. DL3 Realty is a for-profit community development organization that focuses its work on the south and southwest sides. The firm has done a lot of retail work that has brought jobs to the area, including a Blue Cross Blue Shield customer care center, which has brought well-paying call center jobs and management jobs, just as a for example of one of our projects. And then the firm started to get into housing as well as commercial, which then brought me into the picture. And so I've started up that group for the firm. And this is how we were able to combine the commercial and the housing in the Thrive Exchange initiative, which we then joined with Chicago Family here. We initially responded to an Invest Southwest request for proposals. Leon Walker, the owner of DL3 Realty, the managing partner, he and the former CEO of Chicago Family Health, Barrett Hatches, know each other very well and for many, many years. And the bank building, which you saw in one of the images, and we can look at it, it's a former bank building, was a natural place for a health center because this is a federally qualified, medically underserved area. And the area also needs more housing. And those were kind of a natural pair. In fact, it's in the affordable housing world, it is a frequent pairing to see some kind of medical use with some kind of housing use. Sometimes the housing is transitional housing for people coming out of a hospital situation, or to help them, people who are experiencing homelessness, avoid avoid having to go back out onto the streets after medical procedures. So there's a lot of ways in which these things pair together. In this instance, the housing that we're doing is a luxury affordable workforce housing. at rents that are a little bit above the market to bring people into the area, because many South and Southwest side communities have lost population in the past, roughly 50 years. And part of what they need to revitalize is to bring people in and to have housing options at a lot of different price points to fix what is currently, in some cases, a broken housing market. So Chicago Family and DL3 teamed up together to bring this initial part of the project, along with Revere Properties and Neighborhood Housing Services of Chicago. And as we got together and started working in the area, we realized that several other things needed to happen as well. And the project grew from the Invest Southwest Award, which we won, to then looking at the applying for the Pritzker Traubert Prize to even make it bigger. And although we didn't win Pritzker, we will be able to do those pieces. It will just take longer, but we believe that we're going to be able to fulfill the whole $100 million transformational initiative.
As Tanya said, the background of this project really started with looking at the community and looking what was needed. Some other key initiative elements were that it is a TOD, a transit-oriented development. It's located near the Metro line. Again, mixed-use income development with retail and market rate housing. Reuse of that banking building, which is beautiful, has some beautiful aspects on the inside. And then community wealth building project, as well as making the area more viable with street planting and landscaping, and making sure that there's retail and commercial opportunities available in the community. What we wanted to do with this project is reimagine what's possible. Thrive Exchange looks to transform the eastern end of the 79th corridor by ending a vicious cycle. And with that, the vicious cycle has resulted in deteriorated housing stock, poor health outcomes, persistent violence in the community, vacant storefronts and abandoned buildings. And what we want to do and envision for the area is a revitalized and thriving community, and by eliminating blight and bringing families and healthcare back to this medically underserved area, and creating jobs for local residents, as well as reactivating storefronts and local entrepreneurship. This is one of the documents that we put together in our Pritzker Traubert RFP. We love this mind map. It is a visualization of what we see for that intersection, again, with the focus on housing, healthcare, and wealth building for the community. Tanya, did you want to add anything?
Yeah, so I would point out that we're looking at housing at different income levels. So we're looking at some 76 rentals, 24 condominiums, which will come a little bit later. So this is a phased development. This mind map also shows some of the great assets that South Shore has, including the metro station and Rainbow Beach. It actually has really nice housing stock as well, where it's not, too deteriorated to repair. Wealth building includes a lot of retail, but also what Chicago Family will be doing. Chicago Family hires from the neighborhoods in which they have their offices there. And so they will create high-paying, it's a range, of course, as you know, but well-paying jobs that will make people want to live here again.
And so what we're looking to do really is building a neighborhood. Again, this is $100 million investment with 200,000 square foot of development with really 4 shovel-ready projects. And you can see those noted here with 2 housing areas, condominiums, and then our health center. And then we are looking, although we did not get the Pritzker Prize, the Chicago Prize, we are looking to move forward and hopefully have everything completed by 2025 for the entire neighborhood.
So I'd say this provides just some additional details you can see on exactly what we're doing where. The South Residential Building is funded and we're moving that forward, and that'll be the first thing to break ground. Chicago Families Health Center should follow shortly thereafter. And actually, I should say, we are also acquiring Star Plaza Retail Center. That may actually be the first thing that moves forward because it's a simple acquisition. So that was an interesting one, I think, because that was not originally part of our conversation, but there are some social negatives, shall we say, that come out of the Star Plaza Retail Center. There's some issues with management and some things happening there. And so DL3 realized that we needed to acquire that from the current owners in order to turn the area from, as Sherry was saying, the vicious cycle to the virtuous cycle. This is a key piece of changing this corner.
So we really see this project as an initiative that focuses on various aspects of social determinants of health. The first area being, of course, health. And I'll speak to that as I talk about the health center in more detail. This is our lovely picture of what we envision our health center to be at the Ringer Building site. We're looking at almost 24,000 square feet of the health center, where we're looking to create jobs. Of course, we are looking to provide high quality healthcare services. And we wanted to be a part of this initiative because we wanted to expand further into the South Side community, of which we have been a part of for 45 years. This gives us the opportunity to continue to focus not only on physical health, but again, all of the additional social determinants of health that contribute to overall well-being, including economic stability, healthcare, community safety, neighborhood and physical environment. All of those things are important in helping to be a part of building a neighborhood, and being a part of that, we found that to be very important and attractive. Chicago Family, as I said, has had a 45-year presence on the South Side of Chicago, and we know that communities thrive when their basic social and healthcare needs are met. With Thrive Exchange, we had the opportunity to bring affordable, innovative, high quality, and integrated healthcare, as well as safe and secure housing and workforce development to ensure that this community has the resources that it needs available to them. Next slide. Chicago Family Health Center is a trusted community partner. We've had 6 locations on the South Side of Chicago in various communities. This is a couple of pictures of 2 of our locations. Our main location, which is in South Chicago, and then our Pullman location. We also have locations in Roseland, Pullman, Chicago Lawn, as well as our school-based health center at Chicago Vocational Career Academy, CVCA. Next slide. A little history about Chicago Family. We were actually started as Claretian Medical Center by the Claretian Ministries back in 1977. We were designated as an FQHC in 1998. We earned Joint Commission status accreditation in 2017, and I am happy to say we just went through our accreditation process again in December. So we're very excited to be reaccredited with the Joint Commission. And most recently, as 2021, our reporting for HRSA, we reported over 29,000 patients served in 2021. Next slide. Just some information on our mission, vision, and values. Our goal is to provide and promote health, work to prevent disease and provide treatment through the delivery of quality, accessible primary health care that is culturally sensitive, affordable, and responsive to community and individual needs. As well as our vision and values are listed as well. Next slide. As many of you might not know, FQHCs have been the front line of healthcare for more than 50 years. FQHCs have been the leading providers of health and social services in economically, socially, and politically under-resourced communities. FQHCs provide a vital part of the safety net of healthcare providers to at-risk and underserved population, and provide more than 20 million, provide care to more than 20 million people annually. And this equates to about 1 in 12 people in the United States, and they rely on FQHCs for healthcare. Many people aren't aware of that. But healthcare relies really on community healthcare organization. And the COVID crisis really showed the impact that community health centers had on providing services and getting those services out to the community. Chicago Family Health Center, like I said, provided over 29,000 patients care in 2021, which equated to over 100,000 visits in the areas of pediatrics, men's health, women's health, primary care with some specialty services, as well as dental care, behavioral health services, which has seen an uptick, especially with the onset of COVID. As well as wraparound services. Wraparound services gives us the opportunity to expand our care coordination efforts and provide families with support and focus on social determinants of health referrals. This expanded capacity to community resources provides for more patient and community experience for our patients. With this is like referrals to care management, health education, insurance enrollment and navigation, as well as partnerships with like our IVCC program, the Illinois Breast and Cervical Cancer Program, WIC, programs such as that. So all of this is in an effort to eliminate any barriers to care. In addition, Chicago Family has taken on a lot of things to ensure that we're able to eliminate barriers to care. We've been moving to more technological platforms to assist with those patients who aren't able to get to us by moving to virtual platforms with telehealth services, self-monitoring programs such as our hypertension program, and soon to be our glucose monitoring program. Able to check in, make appointments online, on your phone, on your mobile devices, on your computer. So looking forward to expanding those programs. In addition to that, Chicago Family continues to make sure that we're involved with the community. Being a community health center, that's part of what we do. We do community events, health fairs, all to address issues that are affecting the health and well-being of our communities. These are some pictures of some events that we've had most recently. Our men's health event for 2023, we have a calendar of monthly lunch and learns for the community here at our South Chicago location. We have an annual back to school event. We have all kinds of events and educational opportunities for the community, which helps improve outcomes ultimately for our patients. This is a list of some of our partnerships. Like I said, making sure that we're able to provide some of those wraparound services is ultimately what helps us in providing the care that's needed to break down any barriers to care and improve health outcomes. This is another rendering of what we envision for the health center and the entire neighborhood project. This is a rendering looking north on Exchange Street.
Our housing plan includes, as I mentioned, 43 units of luxury affordable workforce housing. So what does that mean? That means it has market rate type of amenities, but it is affordable, you know, to the community rent levels. But it's got a yoga studio, it's got ground floor retail, it's got excellent design standards. It has the things that you would expect in a market rate apartment, because you know, we want to show that this is really an investment, and the city, which is providing a lot of the funding for this, wants to show that this is a real investment in the neighborhood. It's not just some apartments, it's someplace that is a draw that we would hope people would really want to come to, not just for the people who live in the apartments, but as you can see on the lower left, ground floor retail with a cafe, revitalizing street life, creating a sense of place. It's a destination. It's a neighborhood level destination. You know, it's not a downtown destination, but it's like, yeah, let's go over to, you know, 79th and Exchange and, you know, pick up a cup of coffee. Maybe there's a good quality like fresh food quickie mart. Maybe there's a bike repair shop. And some of these smaller ground floor businesses, we would be looking to populate with folks from the community. You know, we're not the arbiter necessarily of what the community needs in this regard. You know, what do local businesses want to do? What do they see in their community? And so there's an empowerment aspect to that as well. The 24 for-sale condominiums will come later in order, usually, for people to invest in purchasing something, a condominium. They are going to want to see these other elements that are currently vacant. They're going to want to see those occupied before that's usually going to be feasible. But again, it's over time, and it's, you know, phase kind of 1 and 2 at least are funded, and we're moving forward. Next slide, please. Community wealth building plan. So as you can see, we are looking at acquiring and repositioning the Star Plaza Retail Center, which is the image top right. It is currently sort of underutilized, I think I would say, and there's, you know, this old story, but it's so true, a problematic liquor store that currently exists there. So we would be looking to remove that liquor store and put in some more community benefiting uses, kind of a refresh to show that this is not what it used to be. And this is part of creating that new sense of place. And furthermore, with the ground floor retail created in the residential buildings, plus the healthcare jobs at Chicago Family Health's location and at Star Plaza, we would have locally owned businesses and entrepreneurship opportunities, also from live work lofts, which help get entrepreneurial businesses off the ground. You can live there, and then in the front section, you can have your business, whether it's acupuncture or accounting or anything. You can have people come in, and you can have street access so they can find you, come in and do whatever it is you need to do and get your business going. It's an intermediate space between literally your kitchen table in many cases and being able to rent street frontage, you know, separate office space, which can be prohibitively expensive. So this gets you into that middle space to get that traction for you. Next slide, please. And there we are.
We are. So again, we're very excited about moving forward. We think that this is going to be a wonderful addition to the community. Again, revitalizing a community that has been underserved, underinvested, and the people are still there and are in need, and we want to make sure that we're able to give them what it is that will best serve them. And we're open for any questions. Thanks for that.
Yes, I forgot I was the moderator, and this is so exciting, and I want to thank you for sharing the details of the project. We did have a couple of questions that were posted, and I'll start with you, Ms. Kadakia. Is the project working with HUD on the affordable housing aspect?
Not with HUD per se. There are a number of ways that funds come into a project in order to make it affordable. And in this case, we're working with the city, and we were able to put it together entirely with city funds, which is helpful in the sense that having really one primary funding relationship makes the deal less complicated. And if you can do it that way, it tends to move faster and be a little bit easier to put together.
Okay, thank you for that. Ms. Pace,
Mhm.
is there a plan for a pharmacy within the FQHC? And I guess this is for you also, Ms. Katakia, grocery and or nutritional support within the project?
We are looking at having pharmacy services. We may or may not, just depending on space planning, have the pharmacy embedded. We are expanding pharmacy services in Chicago Family as a whole, and the pharmacy delivery will be a part of that. So pharmacy services will be a part of the project. So yes, as far as grocery, a grocery store per se is not a part of the project as is, but we have a partnership. Chicago Family has a partnership with the Urban Growers Collective, and we are looking for them to have some space in our community space in the health center. Currently, what we do with them is every Friday, they bring their food truck that they grow fruits and vegetables in their urban garden to the health center, and have a shopping experience for patients to come onto the truck and have their $10 vouchers to buy food boxes so that they could have access to fresh food. We're looking for that partnership to continue at our South Shore location. It may not be a food truck. We may actually have space embedded in the health center for that.
And I'd like to comment on, we are very aware that the community is concerned and wants more grocery options. And, of course, we're very supportive of that. However, the site is not big enough to have a grocery store, not a full grocery store. We certainly are talking with very small scale grocers that can be in maybe 1,500 square feet, something like that. Or maybe a little bit larger, but somewhere in that neighborhood. We would love to be able to include something like that, maybe fresh food focused, of course. But we're in the process of seeing who we can find for that. Grocery stores have kind of specific requirements. They would need to be on a more, just information, they need to be in a more major street with more traffic and more visibility. And they're, again, fairly large footprint. So we would happily work with somebody on another site for that. It's just not feasible to get a major grocer on this site.
Okay, thank you. Okay, are there any opportunities for community-based organizations and other nonprofits from neighboring communities to support this development?
Certainly there are. And actually, one of the things, we could, I'm sure Sherry and I could talk about this for like 5 hours because we've done so many things, but we have done a lot of contact with community organizations, including South Shore Chamber of Commerce, South Chicago Chamber of Commerce, I mean, I can't really even name all of them off the top of my head, but we engaged with Dr. Carol Adams, who does a lot of community engagement work. That's part of what she does in order to help facilitate that. And we had a big event at the South Shore
Cultural Center.
Cultural Center. I knew it wasn't Country Club. That didn't make any sense. Cultural Center. For that specific purpose, to answer questions. The alderman was there. There are a lot of community organizations, as many as we could, were invited, and we continue to take any input and love to hear from people, and that's an ongoing process.
Great. Okay, the social determinants of health are key to serving this community. Tell us more about how they will address and include transportation and access. And I want to add one other aspect as you were presenting, unless I overlooked it or did not hear it, South Shore Hospital, any partnership with that. So if you can address those, and if you need me to repeat anything, I will.
Well, transportation, again, right behind us is the Metro line, and we have access in most of our health centers. We always make sure that we are very close to a bus line. So we always look for those opportunities. In addition, part of what community health centers do with our enabling or wraparound services is make sure that we use our community health workers or our patient resource navigators to assist our patients with transportation services, whether that is through insurance navigation, whether that's through bus passes, or taxi or cab services. That is something that we integrate into our services overall. As far as, what was the second part of the question? I'm sorry.
Relationship or partnership with South Shore Hospital.
So South Shore Hospital is already a partner. We, for Chicago Family, actually, the president, the CEO, and I meet regularly once a month on our partnership. We are highly integrated with our behavioral health opportunities, as well as referrals for some specialty services. So that's a partnership that we would see being even stronger as we would be even closer to in location with our new site.
Okay. Ms. Kadahia, any plans for the modernization of the Metro Rail, and how far would that extend?
Metro has actually modernized or improved this specific stop. So let me just say, Metro is a kind of a creature in and of itself, and we have been engaging with them, of course. One of the things that we're engaging with them on is we need to access some of their space for the parking for the housing. We do feel like we need a certain amount of parking to improve marketability or to maximize marketability of the apartments. I think that would be important, but it's still a transit-oriented development at its core, and so the parking is kind of ancillary. Nonetheless, I think the larger point is that Metro station has just recently been rehabilitated. So it's a good-looking Metro stop at this point, and I know that they're improving other stations as well.
Great, thank you. We have another question from the audience, and then I'll try to move us along. I can't believe an hour is almost up. For Ms. Pace, how does home health care factor into your care continuum and expansion? What type of provider partnerships are you pursuing to eliminate barriers to care?
As far as home health care, it isn't a service that we provide directly, but it is a service that we provide via referral. So we have referral partners that we work with and utilize our providers' discretion when those services are needed to process those referrals.
Great, thank you. Okay, we'll move on to probably what has you out with PTSD some days. How was the process of the $10 million Chicago prize? Were there, though we know you didn't win, but just the opportunity to present and do it, and I was impressed. I would have, if I had the money, I would have funded you. But we were wondering, how was that process for you all personally and professionally?
Well, I mean, I would say it was a very, very rigorous process, but I would also say it was very well thought out, which is not something I can say about every grant that I've applied for on both sides of that. I mean, they really thought about how, thought about how they were evaluating the finalists. The reviewers were very knowledgeable about their field and about different fields. They were not entirely just on the general not-for-profit side. They brought in reviewers with specific knowledge of housing, of medical issues, which I thought was actually really sharpened our project. Mm-hmm. And that was the intent on Pritzker Traubert's side, was to sharpen the thought process and the projects.
I would agree. I actually would say that I don't think that I have any PTSD from that RFP process. I think it was a fantastic experience. As Tanya said, it gave us the opportunity to really hone in on what we already knew was important, but really sharpen it and make it even better. So it was a great experience. It really was.
I agree. And we got to collaborate with, I mean, I got to know Sherry. I mean, but beyond that, I mean, we really collaborated with some extremely talented people that I was so fortunate to get to know better through the process. Mm-hmm. And to learn from them. I thought it was fantastic.
I agree.
We have another question and input from the chat, so we'll go back to that of services. And this plays into one of the questions that I was thinking about, how you would continue to engage the South Shore community that's not right there in those housing units that you're building and retain engagement. And then there was a question, can you speak more to mental health support? The request for therapy, small activity-based programs that bring people together, knitting clubs, cooking clubs, that will allow the community to talk and surface its own problem solving, using their knowledge while being busy with their hands. So how would you engage them with other activities? The mental health, I would like to start with, if you can.
Okay, I'll jump in on the mental health aspect. Chicago Family has been practicing and moving all of our services for mental health more into the integrated behavioral health model. And with that, that is making sure that all of our patients who come in for regular medical exams, that our primary care providers are aware and are making sure that they are assessing our patients for any mental health crises or adverse events, using evaluation tools and being able to connect immediately with a behavioral health provider on site. We have a whole warm handoff process. We have behavioral health providers integrated in each of our clinics, in each of our hallways, so that we can do that warm handoff immediately at the end of that visit to have a behavioral health visit on site. That, in addition to the expansion with telehealth services, really has moved our behavioral health and expanded our behavioral health program. With our South Shore location, we are looking for an opportunity to have and open back up to have more community space available for activity-based programming, group session activities. COVID is something that really put a dampered a lot of those things. Those are things that we've done in the past, and we're slowly opening back up at our locations that are currently open, but we are being thoughtful as we plan our new health center to actually have dedicated space for those type of activities as well.
Thank you.
Mm-hmm.
It's been noted that the project has already received about $60 million through the city's Invest Southwest 2021 competition. What additional funds are needed for the full project? And are there any plans for DL3 Realty to expand to similar communities throughout the South Side?
Oh, yeah, absolutely. So I'll address the last thing first. We work in Woodlawn and Inglewood as well currently. We've done quite a bit in Woodlawn. We have a project already in progress called Park Station with a partner organization, the Michaels organization partnership on our development side. We have a project, solo project called Thrive Inglewood, which we will be closing in early March and breaking ground. And then we've got this one, and this will eventually be two separate projects. So the funding that we have is a $10 million Invest Southwest, plus some additional funds in order to build the housing. The housing alone is probably a $30-ish million project right there. Things are surprisingly expensive. Construction costs have been escalating by 1% a month, if you can believe that. So it's difficult right now, and the construction costs are extremely, extremely high. It's a tough environment, but we're making it happen. And similarly, we're working with Sherry to help them do, the real estate kind of nuts and bolts on their project as well. And that'll be another, give or take $15 million piece of it. And then we're acquiring Star Plaza. So what we need to do in terms of additional funds is that north residential site. We need to apply for city funding for that site. It'll be a phase 2, and that'll be another, 50 units, give or take. So we are, it's going to be phased, and we're going to have to apply over time, but we're getting there on this one. And we've got other projects going on, and for sure other south and southwest sides of the city.
Okay. You mentioned Inglewood and the project there, and we all know in the news lately that that's becoming another food desert, especially with the vacancy of the Whole Foods grocery store. Any plans to address that and in the other communities? And Ms. Pace, with you also, you may know something that we don't know that you can share.
Well, let me just comment quickly on the Whole Foods in Inglewood. So that is a DL3 development. I'm not sure that folks are aware of that. When Whole Foods was acquired by Amazon, they changed their business plan, shall we say. But we have another grocer slated to go in. This is not my area of the company, so I can't really comment on it too much further than that. But we do have another grocer pretty much lined up. So we're doing everything we can to avoid it becoming a food desert for sure. That is not what we're trying to do. It's very much the opposite. And DL3 has developed other grocery stores, the Jewel in Woodlawn, for example. We did a fee developer. In other words, we don't still own that, but we built that for somebody else for the Jewel. When we can find opportunities to build grocery stores, we can certainly do that. Absolutely. Large national chains have their certain kind of requirements, which most grocers are. Or even regional. So we have to work with the needs and the requirements of whoever it is that would ultimately be the operator.
Thank you. Anything you want to add, Ms. Pace?
No, I was fully supportive as we go out into the community. That's something definitely, that's a message that we hear quite often. And so we hear that, and again, larger changes, larger grocery chains are something that is out of my scope. But if we have opportunities with, like, our partnership with the Urban Grower Collective and smaller steps that we're able to contribute, we definitely look to expand those opportunities for our community.
Great, thank you. So it looks like we have about 5 to 6 minutes left. Is there anything that we did not cover for the participants that you would like to put in the chat, or questions? Please do so now. I am monitoring those and seeing a lot of feedback and appreciate it. But in the meantime, if you all want to share, the panelists want to share anything else or encouragement, and I see the 1908 in the background. So hello, Sarah.
Yeah.
And would like to continue with this discussion and be involved in IOMC, you're more than welcome. I mean, this is just fantastic. I get so excited, and I want to encourage DL3 to come on a little bit further south to the 100. We need
We are happy to.
We need you out here. So anything else you would like to add?
No, this was a great
How can
opportunity.
we support you all? That's what I would like to know. How can we support you in City Hall, in Springfield? What can we do as people who live in these communities?
I mean, what I would say is, do let the alderman know, that you support this project. Let your Representative Tarver know that you support the project. And we're always happy to provide information should anybody want to know anything further or contact me with any particular questions. I'm happy to share. That's what that's absolutely part of my job, is to make sure that we're hearing what the community is saying, and incorporating it when we can, and bring in this great housing for everybody.
Absolutely, and same for the health center support as well. Again, we are looking for funding to help push us over the finish line with that. So if you're aware of banking partnerships who are interested in assisting in the healthcare space, supporting us in with legislators and the alderman's office, that would all be helpful in helping us again push our project over the finish line.
Great. We did have one more question to come in.
Mm-hmm.
Is there a role for the financiers, bank partners of the project to provide financial education to the project?
I think so. I can answer your question a couple different ways. So I'm not exactly sure how you mean it, is what I'm trying to say, but we do have a couple of, bank partners. We haven't actually selected them yet, but NHS will be providing financial services both to the residents of the buildings and available to members of the neighborhood if that's what you're looking for. And it will be tailored to where folks are, wherever that may be, whether it's credit repair, whether it's home ownership, sort of prep, in order to get to the point where you can move into that. So we have NHS that we're bringing in for that specific reason. So that may be what you're looking for the bank partners to do. I'm not completely sure. But there is certainly a role for financial education, yes.
Okay, so many times we see that projects like this come into our communities, and then if it's not a payoff or a return on investment, which we all understand that's needed, just like to encourage that we all just stick in there, hang in there. It will be great. I'm always just wahoo for the Southwest. We see development all over the city, and we tend to get left out. So I would like to personally thank the two of you for the work that you and your companies are doing. And again, to give you one last shout out, as we're at 9:29, and Deborah likes to end on time.
Well, thank you for that. And I think that the two of us are both from organizations that are dedicated to the South Side. DL3 owner and founder Leon Walker has a strong relationship with the South Side, going back to his parents and their development of a daycare center back in the 70s. And again, Chicago Family has been stalwart in the community since 1977. So we look forward to making sure we are mainstays here. So and making sure that we're able to stay here and provide everything that's needed to the community.
Thank you, we appreciate that. And I would say to the panelists, don't forget to look for more information on the February 24th webinar, the Turn on Health. And if you're interested in becoming a fellow, please contact Deborah Hodges at 312-709-2685 or IMOC staff at IOMC.org and visit the website IMLC.org for more information. So on behalf of the Institute of Medicine Chicago, it's a pleasure to be with you today, and we thank you all for your support. The attendance at these sessions have surpassed over 1,200 attendees in the past year. We have some really good topics, a range of topics, and we would like you to please feel free to share ideas with us on other topics you would like to see at the Institute of Medicine. Also, if you have an opportunity, please follow us on LinkedIn, check out our blogs, which are very, very good. I always learn something new from those, and you can visit the website for that. So again, I thank the two of our panelists and our participants and really appreciate you joining us on this Friday morning.